afternoon, good night, wherever you are in the world. This is Dr. Jacqueline King. And as I always say, we bring amazing people to you doing amazing things. And today will not disappoint you. I have Dr. Michael Jones, the plastic surgeon, the only plastic surgeon you should be going to. How you doing, Dr. Jones?
I'm doing great. It is a pleasure to be here today.
It's a pleasure having you. We've been trying to make this happen for a long time. And I am so impressed with everything that you do. But let's start a little bit at the beginning. Did you always want to be a doctor?
I always wanted to be a doctor. That was kind of like something that I knew that I wanted to be from the earliest time in my life. Although I thought I was going to be a vet at first. But then I realized that I actually wanted to treat people. And then I realized that I really liked making people happy. And so when I first started off as a surgeon, I was doing head and neck surgery, cancer surgery. And I really enjoyed meeting my patients, getting to know my patients, getting to know their families. But when you're dealing with cancer, sometimes you can't always win. And so a lot of times we would invest so much energy getting to know each other, going through the surgery, helping them fight that cancer battle. And yet, no matter what I did, they would sometimes succumb to the cancer. So that made me kind of want to pivot and kind of just deal with more of the cosmetic and reconstructive aspects of plastic surgery so that I could grow old with my patients. I enjoy that relationship.
That's awesome. So did you have to take more training? I mean, how did that work? Because you were already a surgeon, you just switched, or how did that work?
Well, that's a good question. So in the head and neck surgical training that I did, we do a lot of facial plastic surgery anyway. And then I did a year of a fellowship in cosmetics and furthering, involved with cosmetic and reconstructive surgery. And then after that, I actually went and apprenticed with several plastic surgeons here in the States and abroad to really get fine-tuned on the aspects of treating cosmetic deformities and really making a difference in the cosmetic nature of people's beings.
So you're pretty rare. I'm thinking there aren't that many African American plastic surgeons, or am I wrong?
Well, it's interesting. Overall, there isn't very many, but I do seem to come across them because we're in similar circles. But when you look at the numbers, there's probably only 2 to 4% of the plastic surgeons or cosmetic surgeons in the country are black. That's a very small number.
Right. So you're in demand. Or you should be in demand.
Yeah.
What are some of the things that you do?
Well, we are blessed to be able to do the full gamut of plastic surgery in our offices. We have offices all over the country, in New York, New Jersey, DC, Atlanta, Fort Lauderdale, Houston, LA. And on the cosmetic side of the practice, we're doing everything from facelifts, eye lifts, neck lifts, eyelid lifts, to breast augmentation, breast reduction, mastopexy or breast lifting. We do tummy tucks, we do a lot of liposuction, we do fat transfer either to the face, to the breast, or to the butt. We do a lot of skin removal surgery. A lot of people are losing weight these days, either from semaglutide, the GLP-1 drugs, or just from gastric sleeves or bariatric surgery. And so we do a lot of brachioplasties, abdominoplasties, body lifts, thigh lifts. And that's kind of all the bread and butter cosmetic stuff. But then on the reconstructive side, or the what our specials, I like to say our superpower is in treating people that are suffering from keloids. So 20% of people of color suffer from keloids. So that's a lot of people when you think about it, not only nationwide, but worldwide. And so very early on, we started treating people that were suffering. They were walking in the door saying, hey, I'm tired of going to my dermatologist, getting these Kenalog or steroid injections. That's painful. I want to just get rid of this keloid. We would take it out, and lo and behold, in 2 to 3 weeks, it was back again. And then I would take it out again, and it would come back again, bigger. And so very early on in our practice, we decided that this was a problem that needed a lot of focus. So we then started doing research, actually not experimenting, but actually doing studies with platelet-rich plasma, with superficial radiation therapy, and we found that we were getting better success in treating the keloids than anyone else was getting in the medical literature. So we then started publishing our results and then made it a focus of ours to really go out and make a difference in our community, because it's our community, people of color, that are suffering so much from these painful keloids. And the insurance companies really didn't want to embrace it because it's us.
So they're still not covered?
Every single case that I do gets denied. Every single one. I have to fight, appeal. It may take us 3 years to get paid from an insurance company.
That's
it.
Not good.
No.
So you said that they come back. So you have found a way where they don't come back?
We have indeed. So currently, or the last paper that we published, 90% of the patients that we treated were cured. So only 1 out of 10 came back. And we're seeing that it's pretty consistent. That was over 10 years ago that we published that paper. And for the last 10 years, our results have actually only gotten better, because we've gotten better in knowing what to do post-operatively for our patients. And so it's a wonderful feeling to know that we're treating people that have gone to other doctors that have failed. We get referrals from other doctors because they don't want to deal with the problem, because it really makes the doctor feel like a failure. They cut it out, it comes back. They cut it out, it comes back. Eventually, some of our patients tell us that the doctors just told us not to come back to them anymore. And so we enjoy being that place. We're very honored to be that place that people that are suffering, and these things are painful. You know, they're tumorous growths of scar tissue that are squeezing on the nerve endings, and it can cause shooting pains at any time of the day, but it most oftenly is worse at night. So they don't get a good night's sleep, and they wake up and they don't perform well during the day. They may not do well in school or at their job. They may not get promotions. So it really is something that can drastically affect the person's quality of life.
Where are some of the places, I know I've seen them on the back of the earlobes, where are some of the places that they form, and who's more likely to get them? Or is there anyone?
Well, that's a great question. So the most common place that we get them is in the ear. Why? Because we pierce our ears, and the ear tends to be a place that, for whatever reason, we form keloids. Men who get shaven very closely, sometimes as the hair is growing back, because our hair is curly, will get ingrown hairs, and now that inflammation will lead to keloids in the beard distribution. Men also get their hair cut short in the back, and so the posterior scalp tends to be a place where a lot of men get keloids. Then, for whatever reason, men and women in the center of our chests tend to get keloids. It may be because of acne, it could be because of ingrown hairs, but that tends to be a spot that's very common, and it's also very challenging for the patient, because every movement you do in life involves stretching your chest. And when we remove them, it's challenging because there's a lot of gravity that's working against us. So if you're a woman and you have large breasts, the gravity of the breast is pulling that incision apart. And if you're a man with large pecs, everything you do is pulling that incision apart. So it's a very challenging removal in the chest area, but we do very well with it.
Sounds like you have an amazing practice. Are you the only physician, or do you have others?
No, we have a doctor down in Atlanta. She's fantastic, Dr. Willis. And we have Dr. Roston also in New York City, who's helping me lead the charge in New York. We have a great team of nurse practitioners, physician's assistants, some of whom are also treating the keloids independently. So we have a great team of people that really empathize with our patients and really know what they're doing in treating these lesions.
And you're cutting edge, so I know that you have I won't say a GoFundMe, but a way that people who want to contribute can do that. How would they do that?
Well, thank you for that. So Kathleen and I started a not-for-profit Operation Keloid many years ago because we saw a need for patients who didn't have the wherewithal, either financially or didn't have the insurance coverage, to really get the care that they needed. And so we've started that organization, but to our own fault, we haven't been the greatest fundraisers for it. So we haven't really raised all that much money. Currently, our really big initiative at the moment is creating a van that we can do the surgery in, as well as look who's coming to join the party.
I told you, your animals love me.
They really do. My goodness. This is Skippy John Jones here. You know, I don't know if you've ever seen there's a cartoon character, Skippy John Jones, and he looks just like Skippy John Jones, the cartoon character. So we called him Skippy John Jones. That's his name. So currently, yes, we have an initiative to convert this van into a medical van that will be a surgical center in the back. It'll also be a place where we administer the radiation. We had a wonderful donation from Census Healthcare who donated the radiation, the superficial radiation machine. And we're so close to getting it out, but we're $20,000 shy of getting this van out so that we can start actually utilizing it. It's our hope that we will ultimately send this van into communities that are in need. It might be here in the United States, or it could be abroad in the continent of Africa, where we then will tour around and do medical missions once or twice a year with a great team of people like we have in the office already to help these people that are suffering, because we went to Tanzania, Kenya, Nigeria, and there are so many people there that are suffering from keloids.
Have you applied for federal grants, or you haven't really tapped into that?
No, we haven't actually ventured down the federal grant pathway. That seems kind of onerous to me. I'm so busy operating that I haven't ventured down that path.
Okay. Well, that's always an option. So if they want to donate, how would they do that?
To donate, go to operationkeloid.org. It's very easy. You scroll down to the bottom of the page is where you would press the link to donate. You can donate $1. You can donate $2. Anything will help these patients that are suffering and will help us move towards getting this van back out of this conversion so that we can actually start treating the patients that need to be helped.
And they can follow you on several social media pages, and what are they?
We have a lot of social media pages. There's LP Surgeons on Instagram. There's Lexington Plastic Surgeons on Facebook. There's Dr. Keloid, Dr. Keloid on Instagram and Facebook. And so, yeah, there's a lot of different places, too many places to follow us.
Well, we're going to be helping you get the word out, Black Women Empowered, and we thank you for the work that you and Kathleen. In case you all don't know, that this is the proud husband of Kathleen Trigg Jones, who is a BWE famous lady. Mm-hmm. So together, you guys are making a difference, and I thank you for your time today. Anything you want to share?
Just thank you. Thank you for allowing me to be on your platform and sharing a little bit of what we do. It's nice to get the word out. Not too many people know that we do what we do and specialize in the treatments that we treat. And thank you.
You're welcome, and keep up the good work.
All right, thank you.